Well, since the COVID pandemic in 2020, many people infected with the virus have continued to experience rather lingering symptoms years later. A new report from the National Academies of Sciences, Engineering, and Medicine finds that some health effects of long COVID include chronic fatigue and brain fog can impair a person's ability to work or attend school for 6 months to 2 years. So for more on this, we're joined by Dr. Céline Gounder here in Studio 57. She is a CBS News medical contributor and an editor-at-large for public health at KFF. Thanks for joining us.
Good to see you.
As Vlad pointed out earlier, we have not really talked about long COVID in a while, but I've heard some sort of horror stories about the way it could particularly affect some people in terms of their cognition, you know, like forgetting how to brush your teeth, just really crazy stuff. So walk us through the highlights of this study.
So this is a National Academy of Medicine report. It's really meant to help guide the Social Security Administration. They administer disability benefits. And so some people may be disabled enough from long COVID that they really do need those kinds of benefits. But to be clear, you know, this is really based on how functional you are with long COVID. Not everybody with long COVID is going to qualify. Right. But that's what the purpose of this report was. So, you know, I think to me, some of the highlights, vaccination is protective against long COVID. It's not perfect. So a seatbelt and an airbag will protect you in a car accident, but it's not going to prevent every injury. Similarly, vaccination is protective against long COVID. You may still see some people who get long COVID despite having been vaccinated. And women, not surprisingly, people with chronic underlying illnesses and people who had more severe cases of COVID are more likely to progress to long COVID.
So, yeah, that's sort of my question, Céline, which is how do you, we were all susceptible to catching COVID, especially before the vaccines, but biologically speaking, it feels like it's sort of luck of the draw who has it and who doesn't, long COVID.
You know, it depends. Again, were you male or female? You know, as you're getting COVID, did you have underlying medical conditions? How bad was your case? So if you ended up in the ICU or in the hospital, you were way more likely to develop COVID. And then there's certain other factors. You know, are you somebody who's predisposed to autoimmune disease? And we don't know all of the genetics and so on of that.
Sort of like the way people, you know, that there were some people who lost their sense of taste and smell. That never happened to me.
Didn't happen to me
either.
To you? No.
So, like, it's just one of those things, right? Somebody, oh, I can't smell or taste anything. And I'm like, really?
But I also didn't get COVID until we were probably on, like, the second booster or something like that.
Yeah,
so that might have been
you had been vaccinated.
Yeah.
Yeah, that makes a huge difference.
Yeah, I got it after I'd been vaccinated, too.
Yeah,
so that's interesting.
Yeah.
Fascinating.
Listen, before we let you go, I want to pivot to something else. Yeah, we've had Dr. Céline Gounder on a number of times to talk about bird flu. And every time I go, why are we talking about bird flu again? She knows so much. We can talk about so many different things. And now I'm eating my words, though, because we have a new strain of bird flu. A man in Mexico actually died. This is, I presume this is the concern that, you know, viruses mutate.
Yep.
What can you tell us?
So this is a different bird flu from the one that we've been talking about, the one that's in dairy cattle in the United States. That's H5N1. What we saw in Mexico just now is the first case of H5N2 influenza in a human being. This is a 59-year-old man who had multiple underlying medical illnesses, so had already been bedridden for unrelated reasons for several weeks before he got this H5N2 bird flu. It does sound like some of the people he was in close contact with did have some cold-like symptoms. So probably that's where he got it. No one, they've tested everybody. No one currently had the infection, but we're still waiting on antibody tests to see if some of those people might previously and have been the source of the infection.
Right.
So you just sort of broke down the differences between H5N1 and H5N2. Is H5N2 new, brand new, or is it something that we've seen? You know how often there's viruses that are dormant and we haven't seen them for 50, 60, 100 years, but that's not this case.
So it's not new. It's been circulating in poultry, birds for a while. But to see a human case, and you know, this is the first one, and it was fatal. But again, it's not necessarily fatal in everybody. This was somebody who was very ill to begin with. And we just need to get more information on how he got exposed. He was not in direct contact with poultry, but probably one of his contacts might have been, and we just need to find out more about that.
All right.
Dr. Céline Gounder, always great to have you. Thank you.